think you just push it in the screen. Okay. Hello.
How you doing?
How you doing?
Painful.
Oh, that's okay. That's okay. We'll wash them. I'll wash my hands and put some gloves on in a minute anyway. Okay. My name is Emma. I'll be your nurse practitioner student today. Okay.
How you doing?
All right. And what is your name, sir?
Patrick Harmison.
Patrick Harmison. Harmison. Okay. That's with an H, right?
Yes.
All right, Patrick. We're going to talk about why you came here today. But first, we'll just let you know that everything we talk about in here is confidential, and none of your information will be shared with anybody that doesn't have to do with the medical team.
Okay.
Okay. All right. I'm going to have a seat here. All right, Patrick. So it's going to be kind of long, but I'm going to help you through it.
Okay.
So just tell me why you came in today.
So I've been having this cough that's been really irritating the last 3 or 4 days.
Okay.
Pressure in my nasal area, around the eyes or whatnot. So
yeah, that's always horrible.
Really irritating.
Really irritating. And you took some days off from work, I see.
Yeah, I did.
Okay. It's really been bad. Wow, I'm so sorry to hear that. We're gonna try to fix you up though. Okay. So, and how old are you, Patrick?
35.
35. Okay. And are you working right now?
I am. I'm an engineer, mechanical engineer.
Okay. And where do you work at? You know?
Shell.
Okay.
Company, oil and gas.
Okay. And you say the congestion has been for the last 4 days.
Yes.
Have you taken anything for it?
I've taken Mucinex D at the guidance of the pharmacist.
Okay.
I've taken Robitussin as well as Robitussin DM, that is, and Sudafed with pseudoephedrine.
Okay. So the pharmacist recommended these things for you.
Correct.
Okay, and it looks like here you told me that these things were making you feel better.
The Mucinex, not so much. I discontinued that after a couple of days.
Okay.
After no results being seen. But the Robitussin and pseudoephedrine has helped me out quite a bit.
Okay. So Mucinex probably made you drain a little bit more.
Yeah.
Okay. Mucinex. All right. So tell me a little bit more about these symptoms. So are you having any pain with them?
So a little minor headache, and it kind of hurts when I cough. My throat is a little bit itchy, scratchy. It's kind of sore.
Okay.
But there's a lot of pressure, kind of pressure in the ear area and things like that. So.
Okay. Pressure in the ear. So if you had to rate that pressure for me on a scale of 1 to 10, how would you rate that? 10 being the worst, 1 being almost none.
The pressure is probably like 4, 5-ish.
Okay.
But the pain has gotten up to an 8.
Okay, in your head.
Yeah.
It's any pain in your head. Do you feel more pain at different hours of the day sometimes?
Not really.
Usually, because it like some of the things that happens. Like when we wake up, we more stuffed up in the morning, and then in the evening, it seems like it gets a little bit more better because we didn't took medicine and eating. It gets a little bit better. Okay. So when was the last time you took these medications?
A couple hours before I came here.
Okay. So have you been feeling any kind of other feelings like being tired, any weakness?
Yeah, some weakness. Tired. Just given the fact that my body is kind of, I guess, adjusting to the sickness. I guess. So.
Do you have these things often? Do you have these feelings of tired, weakness often?
No.
Okay, so you don't have. Do you have respiratory symptoms, or have more colds during the year?
No, I don't. So this is like kind of one-off thing.
Okay. Right. So did you kind of feel yourself getting sick? Having like some cold symptoms before, and then it just kind of stayed?
No, not really. Just kind of like came all at once. It seemed.
Okay. Any fevers?
No.
No chills, no fevers, no sweating at nighttime.
No.
Let's see here. All right. And you don't have any type of history of taking anything or being around someone that was exposed to something?
No.
No one that has a cold or the flu or anything like that?
No.
We're going to go into some more of your medications that you're taking here. I see that the last time we seen you you were taking some multivitamins.
Yes.
Are you still taking your multivitamins?
I am still.
Okay. And that you were taking those the Sudafed. Do you remember how you were taking? How many you were taking?
As the recommendation of the box.
Okay. Was both of them by the recommendation on the box?
Yes.
Recommendations on the box. Okay. And the Mucinex, you said you're not taking that anymore.
No.
Okay. And are your allergies still the same? What were you last time we seen you said your allergies? You didn't have any allergies.
Correct.
Okay. And your contraceptive methods that you're using?
Condoms.
Okay, still with condoms. Okay. Still sexually active at this time? Still
yes.
Sexually active at this time. Okay. Immunizations that you had last time you said?
The last 2010 was the last tetanus shot. So.
Okay. You had the tetanus shot from the last time because you got cut at the job. I remember. Okay. All right. And those with what your childhood, just to reconfirm your childhood illnesses, your childhood immunizations, you had Tdap, you had the hepatitis, yes. You had the MMR, the measles, the lumps, the rubella.
Correct.
You had all of those shots and the parvo. You probably didn't have parvo because you are too young for parvo. Let's see here. And no type of pneumonia shots.
No.
Because you don't have any history of being immunosuppressed or anything like that. You know, like people have cancer. Sometimes their white blood cells go down where we can't fight infection.
Right. No, none of that.
No, sure. All right. Okay. And what about HPV? Were you ever off of that?
No, I haven't.
Okay. No HPV and zoster. Have you ever heard of that being a zoster vaccine?
No.
Okay. So it's highly relevant to a different demographic of people. If I know that you have a physician and that you would have been recommended to get those if you needed that.
Okay.
All right. So back last time we seen you, you said that you had went to the doctors 2 months ago, and we got those labs back. Thank you for giving us that referral to him. And you said that you would bring us a copy of them. Did you bring a copy with you?
I did.
Good. We'll give those to the reception. Let me take a look at that. And I'll go over those while I'm sitting here, while we're still going over our messages. Okay. So we're going to talk a little bit about your medical history now.
Okay.
So childhood illnesses. Have you ever been sick in a child that your mom may have told you?
No, I've been relatively healthy all my life.
Okay. So no measles, mumps, chickenpox,
no.
Rubella, no polio. No. Okay. No asthma. Any thing while you were an adult? Any stroke, hypertension. That's real common. With our race and black males at your age to have hypertension. Some type of pre-hypertension. Nobody's ever told you anything like this. Your blood pressure still looks good today.
Okay.
At this meeting, it's a little bit up, but that might just be because you're in some acute distress right now. Okay. No diabetes, no thyroid.
No.
Okay. Any cancer?
No.
And do you have a cold? Have you had a cold before? Any cold-like symptoms?
Now?
Yeah.
No.
Right. Have you ever been hospitalized for anything?
No.
Even as a child, you wasn't hospitalized? That your mom told you? Okay. Right. Ever been in any trauma or any accident injuries? Do you have any disabilities?
No.
Wear glasses, anything like that?
No.
Right. When I say disabilities, I mean, like crutches. Some people wear splints on their wrists, they ankles. Some people have different things, scooters. They have they scoot around on those little scooters that the little kids play with. They scoot around with them. They do when they break their leg. They have them now.
It would probably be fun, but no, I don't.
They have them though. I'm telling you. Walking boots. Those are the things when you put them on that you broke a leg or something like that. Okay. Any transfusions?
No.
Okay. I see here that you donate blood. Thank you.
Yeah.
Okay. So you donate blood twice a year at the blood center. Any particular reason why?
Just to, my charitable givings just make me feel better as a person, I guess.
All right. Great. All right. You know what your blood type is?
No.
Okay. You're going to have to remember that the next time. Right? We have that on these documents, and before you leave, I'll let you know what your blood type is. Okay? All right, all right. We're gonna get into some more of your family history here. Your mother, how old is your mother now?
56.
Okay, 56. And she is alive?
Yes.
Okay. Does she have any type of conditions? Any diabetes, hypertension?
Hypertension and diabetes.
Okay. Anything she's had, surgeries, strokes,
I think she
heart
had
attack?
a sleeve gastrectomy, I believe.
Oh, good,
Yeah.
good. Did she lose weight good?
Oh, yeah.
Wow. That should have taken care of her diabetes then, probably. So she's under care for
Yes.
her conditions. Okay. And your father?
I don't know him.
Okay. You still have siblings, right?
I do.
Okay. And you have a
brother and sister.
brother and sister. How old is your sister?
Sister is 33.
And she's alive?
Yes.
Okay. And does she have any conditions?
She has diabetes.
Okay.
And she had, I think, gestational diabetes as well.
Okay, okay. When she was pregnant, she had a baby. She had
Yeah.
diabetes. Okay, okay. And your brother, how old is he?
He's 38.
Okay, and he's alive.
Yes.
Okay. And does he have any conditions?
He's like has a little bit of hypertension. I think he's like got some kind of mental issues. I don't know what they are though.
Okay. That's something maybe could come and see us and maybe get some help. Yeah. What about your grandparents? Do you know anything about your mother's grandparents? Your mother's father? Your mother's mother? I know you don't know your dad, but
yes. So both of them they lived pretty long lives. I believe. Grandmother was 76. Grandfather was 70. Um, they both had hypertension.
okay.
Grandmother had diabetes as well.
Okay. 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 So these now that runs in the family, right? So we have to watch that. We have to watch that. And we'll talk more about what we can do to make sure that you don't develop those same conditions because you are apt to get those when it's so strong in your family that way. Having it your mother, your sister, your grandmother, the percentage is high. And I know you know about percentages because you're a mechanical engineer, so the percentage it rises very high when you have those three going in at you at the same time. Okay. Any smoking?
No.
No cigarettes.
No.
No pipes. They got those new little e-cigarette things.
Yeah.
No vapors. You don't go to the hookah bars or whatever like that. Okay.
No.
All right. No chewing tobacco.
No.
Okay. All right. And the alcohol use?
Still 1 to 2 drinks every month or so. Not nothing crazy.
And drug use? Any street drug use? Marijuana? Okay, none of that. Cocaine, ecstasy, no synthetic marijuana formations or anything like that. They got all that stuff that those kids are going crazy over there.
Yeah, no,
I feel so sorry for those kids.
I don't want to put that in my body.
Wow, I just can't believe that. Well, where are they getting it from?
Yeah.
What are they doing? Yeah. No heroin, speed, LSD.
No, none of that.
And you've never taken any prescribed medications that wasn't prescribed for you?
No.
All right. So you've never tried any street drugs either?
No, I was an athlete, so
okay. All right. What'd you play?
Football and basketball.
Football and basketball. Well, I wanted to be an athlete, but that didn't work out. All right. So we established that you was a mechanical engineer. And what's the highest level of education that you have?
I have a master's degree.
Okay. All right. Wow, you have succeeded really far at 35.
Yeah, so far so
good. Good. And you currently still single?
Yes, I am.
Okay. And you live alone?
I do.
Okay. You moved here from San Antonio. I know you say you moved here from San Antonio, but what was your living situation like in San Antonio?
Had a 4-bedroom home, and then when I moved here, I kind of downsized.
Okay.
I live in kind of a mid-rise apartment building.
Okay. All right. Right, that's got to be out. You had to get all that stuff out of there.
Yeah, well, I didn't have much, so.
Oh wow. Okay, bachelor pad. All right. So, do you have any things that you like to do? Any hobbies? Or
yeah, I like to play volleyball.
Okay.
I lift weights a little bit. Do some aerobic exercise.
All right.
Things like that.
All right. Okay. All right. So at your job, you work in a office building. I remember you telling me that
Right.
you work in an office building, and the last time you didn't have any chemical exposure, but you did mention that you do go to a chemical plant once a year, and I was wondering, have, do you feel like you would have any exposure there?
No, and I hadn't been in a while, right? So
Okay.
it's been probably like 18 months or so since I've been to one. So
Okay, 18 months.
yeah.
And do you guys have to wear anything? I know like when you go in a chemical plant, you have to wear the protective gear. Do you?
Only if you go into a high vaporous area.
And would you usually wear those type of
Yes,
protective gear?
face mask.
Alright. And last time I didn't get to ask you about the military. Have you ever been in the military?
No, I haven't.
My brother was in the military. Been in the military for 4 years. He loved it. He absolutely loved it. Yes. All right. So, you've been having this since last Thursday. It's what we have documented here.
Correct.
4 days. So, before that, are you still eating?
Yeah, but my appetite has changed a little bit.
Okay, okay. So are you eating less or you just
Less.
okay, okay. Do you feel like you've lost some weight?
Um, Probably 1 or 2 pounds. I don't know.
But
Not
maybe
nothing
just
major.
like in your usual weight.
Yeah.
Okay. All right. So you don't feel like your clothes are fitting you tighter or
No.
loose or anything like that. Okay. So you say you do have the weakness and the fatigue. Yeah, usually when we get colds, we just feel limp, and
Yeah.
just tired all over. Just kind of like generalized ache, just achy.
Yeah.
Yeah. Okay. All right. And you hadn't taken anything for the ache.
No, I haven't.
Any fevers? You said no fevers, no chills, no night sweats. I know you said that. Okay. What about your sleeping? Has your sleeping been disturbed?
A little bit by the coughing, but
Okay.
I guess that's normal.
Yeah, that is normal. That is normal. There's, when you coughing, you can't sleep through that.
Yeah.
Yeah. So is the cough? Do you wake up and you can go back to sleep, or do you have to do something to?
No, I usually go back to sleep. It's just like coughing in your sleep when you didn't stay
Okay,
asleep.
and you wake up. So you're breaking your sleep.
Yeah,
Maybe
but not too bad though.
breaking your sleep. Maybe.
Every like 2 to 3 hours or so, maybe.
Okay. So if you get if you say that told my assistant that the cough was uncontrollable.
Yeah.
Okay,
Yeah.
okay. And that you would get up in the middle of the night and take this Robitussin sometimes.
Yeah, so it's like right by the bed, so I'll take it and go right back to sleep.
Okay. Still taking the recommended dose.
Yes.
Okay. So your diet, you would say that your diet is. Do you do any special diets like like the lactum diet or vegetarian diet?
No, I don't.
What about low sodium, cholesterol?
I don't have a whole lot of sodium. Use a whole lot of sodium anyway, so.
Okay, okay. So do you watch your sodium?
Correct.
Okay. What about the cholesterol?
It's been pretty good.
Okay, and you watch your cholesterol in your food.
Yeah.
Okay, okay. So you would watch that by looking at.
I read the labels. Yes.
Oh, okay, okay, okay. All right. And you do this because of you.
Just everybody's more or less health conscious these days, and
Right.
I'm just kind of falling in line with
Right.
everybody else.
That's good. That's good
Yeah.
because that's what's going to prevent you from getting these comorbidities, these hypertension, diabetes. Okay. All right. So do you usually eat how many meals a day?
3 generally. Every now and then 4, but they're relatively small meals, right?
Okay.
And so eat breakfast. I make sure I eat breakfast, or either eat or have a shake in the morning, and then eat lunch and dinner. So, and a snack sometimes in between. The 2 o'clock rush gets you every now and then.
Right.
So, yeah.
That's right. That's right. If you still at work, you still
Yeah.
eating snacking. I snack myself. I try to bring me some little snacks though, cause I'll snack all day.
Yeah, generally
Get busy.
almonds or something like that. Yeah.
Okay, so what would you say that you have for breakfast in the morning?
Like a pan sausage or two.
Okay.
Eggs maybe, a
Okay.
biscuit or something like that.
Okay.
Nothing too heavy.
And then maybe something, an example for lunch and dinner.
Either a sandwich or a salad.
Okay.
You know.
And
Things.
that you are preparing.
Yeah. Or else when I'm at work, I'll pick up a sandwich at
Okay.
like a Subway or a little sandwich shop like that, something like that. Yeah.
Okay.
But generally, for dinner, I usually cook either fish or chicken, things like that.
Okay. Okay. All right. That's good. Well, we can keep those habits up. It's good to pay a little bit more attention to the breakfast, but that's good. All right. The patient, let's see. So it says that you've been eating popsicles and warm soup.
Yeah, so the popsicles kind of soothe my throat a
Okay.
little bit, and then the soup kind of like they have me
Slips
get some
down.
get some kind of nutrition.
Okay, okay. All right. All right, yeah, the popsicles could actually make it worse because they could swell up your area because it's so cold. But want to kind of keep everything lukewarm, keep that going down. Because when you have a cold like that, let's see. Okay. What about your water intake? How is your water intake?
So I usually drink around a gallon of water a day still.
Okay. Good, good. That's excellent. Okay. You drink any soda waters or anything?
Very, very minimal.
Okay. Very. So if you drink a soda water or lemonade, what would you drink? You know, which one would you drink?
Like lemonade, like
Okay.
maybe 8 ounces. Not too much. Yeah.
Okay. Well, we almost done here. I see that you told the clerk that the lemonade was sweetened with stevia.
Yeah,
Okay.
yeah. That or the raw sugar.
Okay. Wow. I have to get me some of that stevia. I seen it on TV. I haven't used that before. I usually use a little honey, but I haven't used the stevia.
It's not too bad.
If it tastes like that, if it tastes NutraSweetie, I'm not getting that.
No.
Yes, no. All right. Any problems with your hair or your skin or your nails?
No.
Any type of lumps, sores, dryness?
No.
Okay. No changes in the color of your nails or your skin? No odors that you recognize?
No.
And I know that you told me about the headache, that it was a little dull headache that came early in the morning intermittently. Okay. And the head pressure, and that's from the sinus. You feel like that's from the sinus congestion.
Correct.
All right. You've never had any head injuries?
No.
Have you ever been dizzy? Any dizziness since you've been sick?
No.
Any lightheadedness? Just kind of where you feel like you got to sit down?
No.
Any vision changes?
No.
And you've never worn contacts or glasses?
No.
Do you get regular eye examinations?
I do yearly.
Okay, yearly. Okay. And no pain in your eyes, redness?
No.
Okay. Any excessive tearness or dry?
No, I guess when you yawning and coughing and stuff, but that's outside. That's normal.
Okay. Any double vision, blurred vision?
No.
And you don't have any vision changes, problems in your family, glaucoma?
No.
All right. You don't see any specks or floating in front of your eyes, like sometimes when we close our eyes, we see red dots floating in front of our eyes. That's
no.
All you've never seen.
No, none of that.
All right. Any hearing problems?
No.
Okay. Any balance issues where you stand up and you feel like you got to catch your balance?
No.
And you don't have any hearing aids or anything like that?
No.
Okay. And no earaches. Have you ever had the earaches? Any earaches?
No.
All right. So right now you have this sinus pressure, but do you have had these sinus pressure before?
No, I hadn't. This is good. It's kind of new.
Okay.
New thing that came
Okay.
about.
Would that be why you asked the pharmacist about it?
Yeah.
Okay. Okay. And your throat. You say your throat is hurting you right now.
Yeah, it's
Sore.
really irritating. It's kind
Sore.
of
When you swallow, do you feel the soreness when you swallow? Okay. And is it burning?
No, it's just a pain, you know.
Yeah, just
Like
sore. Like
sore
it
throat
just
pain.
you keep swallowing because it's dry.
Yeah.
Okay. And you don't have any dentures.
No.
And you don't know if any kind of bleeding, teeth, gum problem.
No.
No teeth problems in your mouth and rotten teeth in your mouth. And we'll check that out later. But you don't have any that you know of. And do you do dental exams?
Oh yeah. Every twice a year, every 6 months.
Okay. All right. And when was your last one?
September.
Okay. Any soreness of your tongue?
No.
Any dryness and soreness on your tongue? Okay. Have your voice changed? Any hoarseness?
No, not really.
Just a little bit, maybe. Yes, sometimes it's kind of like a little crack.
It's kind of hard for me to hear it, but yeah, it may have.
Okay. What about any swollen glands? Like do you feel like your glands in your neck is a little swollen?
A little bit.
Every time you put you kind of sore.
Yeah.
Maybe that's from like the coughing right here. Anytime, have you ever had any swollen inguinal areas like in your hip here?
No, not
Nothing under your arms swelling, your lymph nodes swelling. Right. And what about neck stiffness? Any neck stiffness?
Just minor, nothing.
Like when you get stiff neck go to bed?
Yeah.
Okay. Right. Have you ever had a breast self-exam?
No.
Okay. Have you ever heard of that?
For men?
For me?
No, I hadn't.
Yeah, men are supposed to have it. It's very rare, but it is supposed to be done.
Okay.
And we will go over that now. Show you how to do that when we do the assessment on you in just a second. Okay. All right. So you've never had any history of lumps or any pain in your breast?
No.
Okay. All right. No nipple discharge?
No.
Okay. Men have nipples.
No.
Nothing might come out them, but if they get sick, something might come out.
Okay. No.
All right. So I know you report that you have the productive cough. What color is the sputum?
I don't know. I hadn't really been looking because it kind of like makes my stomach feel kind of queasy.
Okay.
So.
All right. So that's something very important to do next time. Just look at it real quick.
Okay.
Flush it down. If it gets green or if it gets brown, or we want to know if it had any blood in it. Have you been coughing up any blood?
No, not to my knowledge.
Any blood coming out of your nose? Sometimes when we rub it too much, it gets blood in it. You have any history of tuberculosis?
No.
Okay. Have you ever had pneumonia, asthma?
No, I haven't.
Bronchitis? Okay. What about, have you ever had any chest x-ray? It's almost time for me to go home.
No.
Any wheezing?
No.
Any problems with any chest pleuritic pain? When you take a deep breath, does it hurt when you take a deep breath?
No.
What about any cardiac history? Any problems with your heart?
No.
Okay. Any sounds that's abnormal that the doctor might have told you about?
No.
Okay. And high blood pressure, you do have that in the family, but have you ever had high blood pressure?
No, I haven't.
And then rheumatic fever, I know you told me you didn't have that. Any, I know you say no sounds, but as a child, sometimes we have heart murmurs too. Any murmurs?
No.
Okay. And you've never had any chest pain?
No.
Okay. Any palpitations where you can feel your heart beating in your chest?
No.
Any shortness of breath?
No.
Like when you run, you have shortness of breath, just a normal run?
No.
Any shortness of breath when you lay down? Right. What about in the middle of the night? Do you wake up gasping for air?
No, just coughing, because of this cold.
Okay. Have you ever noticed any swelling in your legs or your arms?
No.
Your fingers? Okay. All right. And none of these things that I've asked you about happened when you was a child either?
No.
That you remember?
Not that I'm aware of.
Okay. So your mother has never told you that you've had problems with your heart when you was a child. Okay. And you've have you ever had a electrocardiogram? You know what that is?
Yes, EKG.
Okay. Have you ever had one of those? Okay. You did. All right. And any other tests that you have?
No, just the physical stuff. Things you go through on your yearly physicals.
Okay. All right. So let's see. So the electrical cardiogram. Um, can you describe that to me?
Um, no, I can't. I don't think I know what it
Oh,
is.
okay.
Sorry.
They put wires on your chest.
Oh, I'm sorry. No.
Oh, okay. Because I was just gonna say, well, why would you have that if you didn't have all these other problems? You kind of scared me a little there, Mr. Patrick.
I'm sorry.
All right, that's okay. All right. Do you have any history of any leg cramps?
No.
Any blood clots that you know of? All right. No varicose veins that you know of. Okay. Any swelling in your legs or your calves or your feet?
No.
Any color changes
Mm-mm.
in your toes, your nails, all even in the bottom, in the middle? You haven't seen any color changes, any tingling,
No, I haven't.
different feelings of numbness in your toes or your fingers?
No.
All right, and we're gonna talk about your stomach now. Do you have any type? I know you don't have any trouble swallowing, but you told me that your throat is scratchy, it's sore, so it's hurting when you swallow.
Uh-huh.
Okay, which would be the reason you're doing the popsicles and the soup.
Correct.
Any history of heartburn?
No.
No. As you say, no appetite changes. Okay. Any nausea?
No.
And bowel movements? How often are you having those bowel movements?
Daily.
Okay. And would you describe the bowel movements to me, like the color of the bowel movement?
Typically brown.
Okay. Okay. Would you call them large or?
Yeah, I think normal.
Okay.
Yeah.
All right. All right. And if you can give me some more descriptions of your bowel habits, the bowel movement that you see, did it have any blood streaks in it?
No.
Okay. And
Floating, I would say.
okay. Okay. Yeah. All right. So do you have any when you go to the bathroom? Do you have any rectal bleeding, like hemorrhoids?
No, none of that.
Have you ever had any bleeding in your stool where your stool is black
No.
or tarry colored?
No.
Any constipation, diarrhea?
No.
Having any abdominal pain? Any food that you don't like, something that makes you sick?
No.
What about belching or gas excessively?
None of that.
Do you have any known history of any problems with your liver?
No.
Okay. Okay. So no jaundice. What someone told you, just nails were yellow and your eyes were yellow. Any gallbladder?
No.
Appendix? You still have your gallbladder and your appendix?
I have both.
Any problems with urination?
No.
No getting up in the middle of the night urinating. Okay. No excessive urinating.
No.
No urgency, frequency.
No.
Not burning. Okay. No pain on urination.
No.
No blood in your urine.
No.
Have you ever had any kidney infections? Any flank pain? That would be the pain on the side.
No.
Any kidney stones?
No. None of that.
And from kidney stones, we usually have like this urethral colic type of pain, and it's kind of like it's a retching, sharp kind of pain. So if you didn't have the kidney stones, you wouldn't have had the colic pain. Okay, all right. And you don't have any reduced sense to urinate. When you go to the urinate, does your stream come out right away?
Yeah,
it's strong and a force, good.
Perfect. No.
All right. All right. Any problems with your genitalia, with your penis?
No.
No problems. No lumps or bumps or anything like that.
Nothing.
No discharge.
No.
Have you ever had any hernias in your abdominal area, or your abdomen?
No.
That you know, no, okay. No sores on your penises. No STDs.
No.
Any masses?
No.
What about swelling of your scrotum?
No.
Mm. And you say you are sexually active.
Right.
Okay. And you're sexually active with women?
Yes.
And you use condoms. And you use condoms since you was 18, it says. You use them every time?
Yes.
Good. Good. All right. Do you have any concerns about HIV infection today?
No.
Maybe getting transmitted with any HIV that
No.
probably didn't use the condom or anything?
No, I use it every time.
All right. Any muscle problems? Any muscle soreness? Any joint stiffness?
No.
Any arthritis? Any gout?
No, none of that.
No back aches, shoulder aches? Okay. No redness or tenderness? No, you say you played football before. No stiffness, weakness? Okay. And no kind of stiff movements or anything like that?
No.
All right. No low back pain? Good. 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 All right. So you said that you have the headaches. I know you said that, and that's new. That only came on with
Correct.
the congestion.
Yeah.
Okay. All right. Well, what about your mood? Have your mood changed and attention?
No, no mood changes. I've been pretty normal, my normal self.
Okay. And no problems with your speech?
No.
You didn't feel like you was a little disoriented, you didn't know what time of day it was?
No.
Any memory problems?
No.
Okay. Any insight problems?
No.
No. No judgment, no dizziness? Okay. Any fainting? Have you ever fainted? Blackouts in your history? Okay. And no numbness and paralysis?
No.
All right. And no pins and needles sticking the numbness?
Mm-mm.
No tremors? No jerking, seizure type of jerking?
No.
Okay. You don't have no history of seizures?
No.
Any blinking, twitching? What about, I know you said that you don't have any, you've never had any lymph node swelling, okay? And you've never had any exposure to being immunosuppressed. That means like, cancer, AIDS, or anything. Nobody's ever told you that your white blood cells count was low.
No.
And you've never had any problems with sores not healing?
No.
Okay. Any recent infections? And no weight loss, no weight gain?
No.
All right. And you don't have any problems with bleeding?
No, I don't.
Okay. Have you ever been anemic?
No.
All right. And have you ever had a transfusion?
No.
All right. Do you have any thyroid issues?
I do not.
Okay. Any heat and cold tolerance? Like, can you not stand to have cold things in your hand or drink cold things? Any excessive sweating?
No.
Or thirst?
No.
Okay. Have you noticed any type of fruity smell to your breath?
No.
And you said no excessive urinating or hunger. Sometimes you're sitting down and you just get this urge which you're just so hungry.
No.
Have you ever had one of those? Okay. And no changes in your glove or your shoe size?
No.
Your shoe size been the same size?
Yeah.
Okay.
I wish it would change to get smaller, but no.
Me too. Me too. All right. Well, we coming to the end right here. All right. Do you have any issues with nervousness?
No.
Any tension?
Pretty normal.
Okay. Any anxiety? Any memory changes? Okay. No ideals of suicide?
Oh, no.
Okay. Good. Okay. Well, what we're looking at here, I've checked out everything right now. What we're going to do is I'm going to wash my hands, and I'm going to get some gloves, and I'm going to take a look in your throat, and I'm going to listen to your heart and your lungs.
Okay.
And then we're going to get you going, get you feeling better.
All right.
All right.
Thank you.
Okay. Oh, Lord, that was too long. I think you're going to go crazy.